And so my goal is really to create health promoting life experiences, help restructure people's lives to where they are health promoting. And in order to access our experiences, you have to be a user of the platform. That way we are making sure that we're getting the data and that it's being tracked.
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
This is the Dr. Haley Show podcast. I'm Dr. Michael Haley, show host. Today's guest is Kwame Terra. He is the CEO and founder of bEHR Health Systems. And he's also someone who set a unique world record that we're going to talk a little bit about. And I'm going to ask the same question again before we got cut off. Because I do think you're the only person that has the answer to this, Kwame. How many miles can you get out of a single pair of sneakers?
Well, I think you can get a lot of miles out of a single pair of sneakers. I don't know the ultimate number. I got about 944 miles of walking out of one pair of sneakers. But they do say you're supposed to replace them every 300 to 400 miles, particularly of running. As far as walking, you could probably do 1,000.
You know, I don't know what's more traumatic to a shoe, walking or running, because you're getting further steps when you're running and you're kind of got a little bounce and you're probably more gentle on the sneaker, but then maybe the internal impact on me. I don't know.
Well,
I don't know.
Yeah, there's definitely more force applied with running. Probably about, I don't remember exactly, but in my head, what's popping up right now is about 3 times, 4 times more force.
Yeah.
But you are spending less time on the ground running than you are when you're walking. Right, so you spend a bit more time, obviously, on the ground when you're walking, and you're hitting every part of the shoe. So I don't know, but my guess is that running causes a bit more wear and tear.
So if you haven't figured it out, Kwame set a world record for walking the most distance in 1 month, 30 days.
Yeah, most steps.
The most steps.
Yeah,
the most steps, not
distance.
distance.
Yeah,
and it was over 2 million.
That's right. Yeah, 2,007,178 steps.
That's definitely crazy. And this might, it might even be offensive. People are going to hear me say this and they're going to be like, Dr. Haley, you don't know what you're talking about. But it'll make sense in a minute.
Sure.
I'm not that impressed because I think that as humans, we're supposed to be capable of that. But we replaced walking with, first, there were horses and camels for the people that could afford them, but the automobile, bicycles, electric bikes now, and we've got all of this transportation and we don't walk anymore. I think we're supposed to, for good health tracking, walk like 10,000 steps a day anyway, right? So I think we should be capable of doing 5 or 6 or 7 times that in a day. We should be capable. But if I tried that, I'd probably rupture my Achilles tendon.
I feel like I almost ruptured mine. I was averaging about 70,000 steps per day. So like, as you were talking, like 7 times that much. And it came out to about 30 to 35 miles of walking per day. And
Well, go
ahead.
I was going to say, what impresses me more than that, though, is you have to be a person that kind of sees no barriers and, driven for accomplishment, and you've got a purpose and you're going to get things done. And to me, that is more impressive than the accomplishment, if that makes sense.
No, I agree. I agree. That's why I tell people that the hardest part was that I had to do it every day, that I had to cover that distance every day, and I had no margin for error. And so just being able to execute on that. If I miss 20,000 steps a day, now I got to do 75,000 steps a day. And every time I did any math around, okay, if I take an off day here, what would that look like? And it's just like, no, not a chance.
So what's the most you did in one day?
I did 87,000 in one day.
87. Okay, to make up for maybe a slow day, huh? Or What would you do
No,
when it rained? What if it rained and stuff?
I was able to walk inside. Yeah, so there's a walk path in the fitness center here at Xavier University, Louisiana, and so I would just I spent hours in there. I spent a lot of hours in there.
Wow.
Yeah.
Um, so it's not necessarily a documented world record because it was counted by an app of some kind.
Yeah. So we're still in the process of getting it ratified, and I think this is part of why the Guinness Book of World Record doesn't have this record is because you're going to have to watch somebody for 30 days walk all day, by their standards, and it is something I would like to do with them at a future date. But we sent into the International Book of Records, and again, so we're in the process right now of getting that ratified, and it seems like I just have to, complete a few forms and identify my witnesses, and we're good to go. So, um, yeah, it's definitely a hard record to track.
Well, you're going to set another world record. Someone's going to set a world record with you for counting the most in a month.
Right, right,
Oh,
yeah,
we can divide that up, I guess. Multiple people can do it.
yeah.
I counted day one, and then we add them together. But
Hmm.
I mean, that there would be a feat in itself.
Yeah, I
Um,
mean, hopefully it's just a matter of witnessing that they were all steps and not, moving my phone back and forth and or my watch back and forth, because that counts as steps sometimes when you're just laying down, moving your arm back and forth. So I think hopefully it's just more of that. I don't think it'd be a matter of somebody literally tallying. That would be ridiculous.
well, let's talk about the why, and what in life brought you to do what you are doing.
Hmm. Yeah, so I started Bear Health. I came up with the vision for Bear Health in 2020 during the COVID pandemic, where the virus was just having a disproportionate effect on the Black community, and I just wanted to do something so that next pandemic or next challenge that we face, we're in better health to have a better outcome. And my first thought was that we don't know how bad we're doing. Like, we know we're not doing well. We know we need to be exercising more. We know we need to be eating better, but I don't think that we are clear on the short and long term implications of our current health status. That if we don't get it together, we could have a heart attack at 45. My mom's friend actually lost her husband to a stroke at age 46, leaving their 13-year-old son to have to grow up without a father. And, these are preventable conditions. And again, the virus is preying on these comorbidities. And I know that it doesn't take much to restore health as it relates to most of these conditions. You just got to remove the things that are driving the condition and make sure you're getting the nutrients that the body needs to function. And I've seen it happen, right? People come down or off their medications in a matter of weeks after following a healthier diet or exercising more. And but the first step was like that awareness, making sure that people understood that. And so that's where we came up with the idea of a health score, and we use that as a core feature of our app, where you get an individualized score and it changes every day depending on how you change, right? So if you go on a run or a walk one day, your score goes up a few points. If you get 3 hours of sleep one night, your score goes down. And then based on those changes, we make recommendations for how you can improve, as well as connect you with healthcare providers, resources, and experiences to help you elevate your overall health. And those experiences is kind of how we got to these steps. And so last year, around May of last year, I was working with a local doctor. He's a community health doctor here in New Orleans. And I told him I wanted to do 1 million steps in 30 days to raise $1 million for Bear Health in 30 days. So that was the idea. And, 1 million steps, that's a significant amount of steps in a month, but something doable, but I think would be, exciting for folks. And so he said he would help me train for it. And so in May, in 30 days, he did 1 million steps, about 33,000 steps per day, 15 miles of walking per day. He actually ended up losing 20 pounds and got taken off his blood pressure medication. And so
Nice.
when I think about my mission, again, this is 2 months into our mission last year, because we just launched the app last year. Somebody walks off their medication. Our goal is to predict, prevent, and reverse the chronic conditions that plague our community. And we did that in
Yeah.
May. And so he
And
passed.
that's what impresses me.
Hmm.
That is huge. That's
Yeah,
impressive.
yeah.
The walking thing, sure, challenging and stuff. But now, did you raise $1 million?
Didn't even launch the campaign. His story kind of took off, because he's also a health educator for Fox 8 here in New Orleans. And so he's talking about it, raving about it. And yeah, never got around to launching that campaign. So he
Okay.
actually passed me the torch for June, and so I did it in June, and then another one of our users did it in 28 days in July. Two users did it in August, and then another one in October. And so we all got to talking about, hey, what's the world record? Do you think any of us can go after the world record? And then, fast forward 4 or 5 months, I decided to go after it in April. So that's kind of how we got to. That's how steps became a big part of the culture at Bear Health, where we have about 2,500 users on the platform now since our launch last year. And
Yeah, you
yeah,
said, did you say 25,000?
100. We have 2,500.
100. Oh,
Mm-hmm.
okay. Okay.
Yeah, not
All
quite
right. Well,
1,000.
yeah, I was gonna. Well, that would have been a huge number. I said, "Whoa, wait,
Mm-hmm.
this is huge already."
Yep.
But you have a oh yeah, you have a growing platform
Yep. Yep.
at 2,500. That's a lot of data.
Absolutely. Um,
Um, is it at this point right now because it's BEHR?
mhm.
Tell me again about the B. How important is that? And do you have to be black to use the app?
Yeah. Yeah. So obviously, you don't have to be black to use the app. Anybody can use the platform, get their health score. It's normalized by all ethnicities and genders and ages. We are interested in solving this problem in particular as it relates to health in the Black community. The policies, practices, and the beliefs that created these disparities were very targeted and unique in creative ways. And based on my education and training, the solution should be equally targeted. So it's not really a matter of, it's not really like a racial or political thing. This is just
No.
if you create solutions for specific individuals or specific communities, then the solutions will be more effective for those individuals and for those communities.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and/or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in. You can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
As a healthcare professional, I'm taught things like black people are more prone to cardiovascular disease.
Mhm.
White people are more prone to skin cancers.
Mhm.
There are differences, and as we understand these and realize that, well, okay, I can do something about the skin cancer prevention by avoiding too much sun.
Mhm.
And when it comes to cardiovascular disease, you can do something about that
Yep.
to prevent these from happening. So there are real differences, real susceptibilities,
Mhm.
and gathering data and understanding it, I think, is brilliant.
Yeah. No, I appreciate it. I'm really, really proud of what we've built because I wanted to do two things. I wanted to communicate clearly to the Black community our current health status, but then I also wanted a way to be able to follow up with people once that awareness was created, because there are tons of workshops and seminars all over the country that are effective, and we need these things. But the follow up is maybe an email a few months later to ask them how they've been doing with their health journey since then. But what if I could see how many steps they were taking per day for the next 6 months, what their diet was like for the next 6 months, and as they fall back into maybe their old habits, as we naturally do because life is stressful and then we need the convenience and the food tastes good and all that stuff, we can send them nudges, or we can at least remind them, hey, or we can show them that their health is declining through this score in real time. And then maybe that's the reminder that they need to either go engage with their healthcare provider or go exercise more. And we call that the health score report. And it's, again, this real time database of our user health insights that we track month over month. So we've been tracking the health score report with Bear Health since November of last year. And it's really cool what we get to see on a month to month basis. So we see total steps taken, total calories burned, total distance covered, total number of workouts. We also get to see the average health score changes overall. So we see the average health score within the entire community by gender, by age, and then also the 7 categories that we track, which is physical activity, physical health, which includes like blood pressure, cholesterol, glucose, things like that, your mental well being, your nutrition, your sleep, your substance use, so alcohol, caffeine, things like that. And we get to see these changes month over month. And since we started tracking it in November, there was a dip from November to December, right? So again, there was probably like a 10 million drop in total steps from November to December. But we can infer what may have been going on, right? So people are celebrating the holidays with their family, so maybe not moving around as much, not focusing on that as much. A lot of kids are home now, and so just a lot of other factors. And so we talked to the users to find
Yeah.
out what maybe was driving that. But then we saw a significant bump in January, and we all know why. There's a bump in activity in January because everybody's got their New Year's goals and things like that. But we've seen an increase in the average health score month over month since then. And there's nothing more fulfilling than being able to create a platform, carry out interventions, events and challenges and messages, and then watch that score improve over time. And so that's our ultimate goal, is to raise that awareness and then be able to know that we improve the health over time.
Now, if you're using the app, is there like you're in first place, or you're in the top 10%, or you're in the middle?
Yeah, yeah. So you can see your individual score. So as far as like your where you fall compared to everyone else, there it shows the average. It's like on your health score dashboard, it shows the average score, so you can see if you fall above or below the average. But it also shows you what range you fall in generally, right? So anything above 680 is considered excellent. The score
Mhm.
is from 0 to 1,000. So anything above 680 is considered excellent. You can say you're aging at a slower rate, right? Your risk of chronic conditions are lower than the average person. 610 to 680 is considered very good. 550 to 610 is considered good. Anything below 550 is considered fair or poor. And in those ranges, those are the folks where they're at slightly elevated risk of developing hypertension, type 2 diabetes, if they don't already have the conditions. Right. And so what we are able to do is when people come on the platform, they get their initial score. We say, hey, based on your score, you may be at risk for these conditions. We highly recommend that you connect with your healthcare provider to go get some testing done to see if you do have these conditions. And we highly recommend that you also join one of our challenges, where these are these general fitness challenges. So we have steps every month, total distance covered every month. We have a running challenge, total mileage challenge, but it's exclusively running. And then we have a calorie burn challenge every month. And anywhere between 50 and 100 people join these challenges on a monthly basis. And it people are competing with strangers all day, every day.
I
Yeah,
think that's great.
yeah.
What's your score?
My score is 803 right now. I've had it's funny. It was 850 something a few weeks ago, but I've been traveling for conferences over the
Hmm.
past 2.5 weeks. And these have been conferences, but they have also been parties, as far as I can tell. And so lots of late nights, lots of alcohol. And so at night, obviously when you drink, your resting heart rate goes up, right? And especially when you don't sleep as much. So my sleep score is getting a nog, so I get points down for that. But when my resting heart rate goes up as well, I get knocks for that in my physical health. And so
Interesting.
I've just been getting knocked around over the past 2 weekends, but I've been sleeping great this week. My score's been going because it actually dipped down to 7, I think 90 something, but now it's back up to 803, and it's largely because of my sleep and resting heart rate getting back into order.
That's interesting.
Yeah.
And going back to the app, I looked it up and I realized it's not BEHR
Mm-hmm.
health. That's,
Yep.
you're not going to find it in the App Store if you do a
Yep.
search for that. For someone that wants to, even right now, pull
Mm-hmm.
out their phone, go to the App Store, what should they search for?
Yeah, so you should search for an app called Dakadoo. So Dakadoo is our technology partner. That's spelled DACADOO. So they've been an incredible partner to us over the past 5 years. They've invested nearly $250,000 into the company to help us get to this point. And in about 3 months, we're going to be migrating over to our own independent platform where it will be called bEHR Health, and you'll get that experience. It'll be more or less the same functionalities within the platform, but the app will say bEHR Health. You will need an access code, and you can type in Dr. Haley for that. dr Haley. It'll be all caps. And yeah, you can create your account, get your health score, join a challenge. We're giving away a bunch of shoes this month. We do challenges that usually are centered around some sort of cultural event or a partnership that we just got. So at the beginning of this year, we actually did a Super Bowl Steps Challenge where we gave away 2 tickets to Super Bowl 59, which was here in New Orleans, for anyone who completed 59,000 steps in a week. So not a crazy amount of steps, right? Maybe 7,000 a day or so. Um, However, every 1,000 steps past 59,000 gave you 10 additional entries into the challenge. So one person did 50,000 steps a day. It was nuts.
I love the competition aspect of it.
Yeah.
The I'm going to guess that maybe 14% of my audience is black because
Hmm.
that's kind of like a population average. So for the other 86%, download the app anyway.
Hmm.
And I'm guessing to keep your numbers pure, you probably enter some information about who you are and what your nationality is and stuff like that. Is that how it
Hmm.
works?
Yeah. So that'll be the case on the official Bear Health app. As of right now, it's all aggregated together.
Oh,
And
okay.
and as far as the breakdown currently, the demographic breakdown currently, we focus on New Orleans for the most part, which is 60% African American. And so the spread right now is probably closer to like 80%, 85% African American, and then 15% non, whether that's Hispanic or white, what have you. But when we migrate over to the official app, we'll be able to stratify the data in any way that we want. Right now, we're kind of limited to one data set, and cleaning it up is a bit complex. And so right now, we just have this one set that we like to say represents the city of New Orleans. But as we're getting closer to our official launch in October, we're just kind of bringing on as many people as we possibly can, especially for this big campaign that we're launching here pretty soon. But yeah, at that
Yeah.
point, it'll ask for race, and there'll be a data point for that, and we'll be able to stratify it and kind of parse things out from there.
Yeah. The data that you can get out of this, I mean, what is the healthiest state in the United States?
Hmm.
And then, well, why might that be?
Yep.
Temperatures, activity levels, people are more dormant in the wintertime, unless you're in Florida,
Hmm.
like I am.
Yep.
And, we're closer to the ocean, so we are probably exposed to less pollution in Florida here.
Hmm.
But we have our other challenges.
Yep.
And, as you can start imagining how big this could be from a data perspective, I mean, literally huge. With that, there I would consider potential problems. For instance, is my data protected?
Hmm.
And how do you handle that? Because what if life insurance companies got a hold of that? Oh, well, your score's not good enough to be
Hmm.
insured under our company, or whatever the case is.
Yep.
How's that?
That's a great question. And right now our business model is direct to consumer, where the user covers the cost. The app right now is free, but when we migrate over to the official app, it'll be $5 per month or $50 per year to start. Uh, when I started this, my goal again is to solve this particular problem and elevate health, not necessarily to build the most lucrative business. We do need to build a lucrative business. And as of right now, the plan is to monetize, again, direct to consumer as well as through advertisements, where we're not sharing data. We're just saying we have these demographic profiles. Are you interested in marketing to them? And so we do have some advertisers in the app right now, vitamin companies, gyms, things like that, who are just interested in this, fitness forward population.
Oh, sure.
Our
Yeah, I would imagine you could have all kinds of sponsors,
brand deals, things like that.
adverts. Yeah.
And we've done a few of those already, and we actually got a $10,000 sponsorship from a pharmaceutical company for our Super Bowl challenge. Right, that helped us get those tickets. Um, but yeah, so that's the optimal model. However, from a data perspective, what I just shared with you, the general health score report, where we're seeing the average scores, total steps, and all that stuff, we're going to share that publicly, but it's all aggregated data. So, anonymized, no one's individual information is being shared. But we're also going to be able to see stratifications by city, state, zip code, partnering organizations, clinics, right? And they may be interested in that data. So the vision right now is, as we for example, partner with run clubs and clinics throughout the country. We bring their users or we bring their communities or their patient populations onto the app. And if they want access to those reports, they have to pay for it and also get consent from the community. Right. And no one's data is being shared unless that agreement is in place. And
Okay.
so that's the vision right now. That's how we monetize that data safely and responsibly, in my opinion, as of right now.
Okay.
There's also obviously an opportunity for research institutions, right, to leverage the data, right, to have real time health data is valuable for institutions, researchers, right, but ideally someone who has a vested interest in um, improving health in communities. And if we structure it right, we can get buy-in both from the community and obviously the institution, whereby a percentage of the funds, let's say there's a zip code that everybody's really interested in and they want access to that real-time data in that community. So you have to subscribe for access, but you have to understand
Hmm.
that a percentage of what you're putting in goes toward investing in improving health in that community, and we'll leverage our expertise from our team as far as like from a health equity perspective on how to improve health in that community. Is that investing in making sure that there are sidewalks in that community? Let's put a grocery store over here, right? Let's do these seminars, right? So because that is our largest financial opportunity, leveraging the data, we have to figure out how we can get buy-in from the community so they can see how this is an opportunity not only for our company, right, to grow our revenue, but to use some of that money to improve their community, to where your lifestyle, you being on the platform, is almost like a vote for money to garner funding for your community.
That's a good way to look at it because it makes sense.
Yep.
So what are the factors that go into the scoring of a person? You mentioned
Yeah.
sleep, steps. What all is
Hmm.
it looking at?
Yeah. So we track over 100 different metrics, or can track over 100 different metrics across these 7 categories of health that we measure. So as I mentioned, sleep, mental well-being, nutrition, mindfulness, even so, right, your attitude or perspective toward your life, physical activity, physical health, so blood pressure, cholesterol, glucose, BMI, waist circumference, and we can add others, right? A1C, just depends. Right now, the generic ones that we use are the ones I just listed, but you can add protein levels, all kinds of stuff.
Yeah.
And then essentially, so the algorithm is based on 300 million person years of health data. And so we know that if someone is eating this many fruits and vegetables per day, that's associated with this, improvement in life expectancy or longevity. And if they're eating this much fried food per week, it's associated with this reduction in life expectancy. And so those are the current data. So each of those answers has a data point associated with it, and you get scored essentially based on that data point. And then you get a score in each category. So you have your nutrition score, your sleep score, your mental well-being score, and then you'll have your overall score. Um, what's cool about it is that while you may be doing good overall, you may be struggling in one category or another, and you'll be able to notice that based on how full the bar is, and so you can go focus on that category. So for me right now, it's sleep. Right, again, I just missed a bunch of sleep for the past 2 weeks because I've just been nonstop at conferences. And so my sleep, everything looks great, and then my sleep is like halfway full. And so now my focus over the next month is to make sure I'm getting my sleep taken care of. Uh, but yeah,
Yeah, I
that's
think that's the one that would get me.
yeah. I think you get most people, even though it's like the most important thing for your health. It is absolutely been hijacked by our society. It's crazy.
Yeah, I don't know. When I get to the end of my life, it might be shortened by not enough sleep, but one thing I'll be able to say, at least I was awake during it. Uh,
Right. Yeah, yeah. There's probably a sweet spot, to where you can like enjoy the whole
there
thing
is.
while you're awake. Because I don't, I wouldn't be one to walk around here sleep deprived and causing problems.
What kind of testimonials have you gotten so far from people using the app?
Yeah,
What are some of your favorites?
yeah. I mean, it definitely starts with Dr. Griggs walking off his medication in 30 days. Uh, each user who's done this like million steps journey has lost 20 plus pounds. The guy who did it in July last year, he lost 28 pounds. He's actually been walking about it. He's been averaging a million steps a month over the past, all of this year. And he's down almost 100 pounds. And again, like being able to see someone come on the platform, learn their health score, be triggered by that, because again, we know we're not doing great, but like to be able to put a number to it, it has created these visceral experiences for people. But it's not so bad that they just throw it away because they're like, well, you don't know anything, you don't know me. Why are you telling me what my health score? How do you know how healthy I am or not? It's I think they're properly offended and then as a consequence motivated, and they get that feedback loop every day, every week, based on their changes because their score is changing. And so
Properly offended.
I think that,
Is that
yeah,
what you said?
that's what I said. Hmm. I think people are properly offended. There was one time we were at a run club and we were doing health score assessments, and a young lady got her score. Overall score was okay. It was in like the maybe close to good, right around fair to good, but her nutrition score was like 300, and she literally screamed. She grabbed her chest and screamed. And okay, that was that moment. 2 weeks later, we're at the same run club, and she comes up to me. She says, "Hey, Kwame, I stopped eating Chick-fil-A all the time. I've been cooking
Oh,
at home. I've been eating more fruits and vegetables, all this stuff, and everything is flowing. Everything is
yeah,
flowing."
yeah.
And, like, right, obviously, so her bowel moves improving, but like that's the impact, right?
Yeah, that's, not just probably weight loss, but now we have gut changes, which probably makes healthy skin and
Mhm.
probably uh, less autoimmune problems. I mean, it
Yep,
all ties together.
yep, yeah.
Yeah,
That I mean,
great.
that's our goal, and I just love seeing that executed on.
Thank you for tuning in to the Dr. Haley Show podcast. Because you made it this far, I have a special coupon code that you can use throughout the month of July 2025. Get $10 off your purchase of $100 or more at HaleyNutrition.com. The coupon code is July 2025. That's JULY 2025. And as usual, you can even use this coupon with on sale and already discounted bundled items. Enjoy the rest of the podcast. Other than the app, what technology do you need to participate?
You only need the app. You need a smartphone. Uh, a smart watch or wearable enhances the experience for sure, right? We get more real time data. So if you have a smart watch, we're getting your resting heart rate, right? We're getting better sleep data if you sleep with your watch. We integrate with Fitbit, Apple Health, Google Fit, Samsung Health, right? Pretty much all of the trackers. And so if you're not using one of those, so long as the one that you are using can send data to Samsung or Apple, we can figure out how to get it to our platform. So that enhances the experience absolutely. Being able to have a wearable device, and as our society country leans more into this remote patient monitoring, this real time monitoring with like continuous glucose monitors and continuous blood pressure monitors. Um, ultimately, I would not like to create a culture where people are obsessed with tracking their health. That doesn't really strike me as health. And when you look at the longest lived populations in the world, they're not like tracking every aspect of their life and grinding out in the gym. They're just like living a good life, and they end up healthy because they're living a good life. And so my goal is really to create health promoting life experiences, help restructure people's lives to where they are health promoting. And in order to access our experiences, you have to be a user of the platform. That way, we are making sure that we're getting the data and that it's being tracked, but that's not the focus. That's kind of like the background feature. Um, and yeah, that's kind of something that we've pivoted to over the past year as run clubs and what have you have become increasingly popular and hitting so many important aspects of health, especially like community and purpose, that we're shifting as a company to focus on that again. Because I don't, if I look outside and I see a bunch of people obsessing over counting their calories and counting their steps and comparing their VO2 maxes, and I had anything to do with that, I would not be very happy. But if I look outside and I see a group of women walking together in community and or family sharing a meal together because we recommend that in the app, or just things that are actually representative of a good life, then I'll be happy that I had created that. And so we're launching what we call Bear Connect, all connected to the app, whereby so long as you're on it, you can engage with and participate in our experiences. But it's focused on life. It'll be run club meetups. It'll be, go grocery shopping with Bear Health. It'll be, breakfast club. All of them will be centered around some form of health promoting activity. But it's really just the activities that people are already doing in their day to day life.
Yeah.
we're trying to avoid making people feel like health is an extra thing. So instead of going grocery shopping by yourself, come grocery shop with us. We hit community, and now we're probably going to have a list that's a little bit more health promoting than what you may be typically doing. And yeah, so then that way it's kind of seamless. It's not this extra thing that you have to do.
Yeah.
Hmm.
What happened to your score when you were walking 2 million steps in a month?
Yeah, it went down a little bit. One, I wasn't sleeping as much because I was walking 14 hours a day and still trying to run my company. And then also like stress, like that. A lot of people think that professional athletes are like unequivocally healthier than the average human being. But there's a trade off when it comes to professional sports, especially
Absolutely.
extreme endurance sports, right? I used to
Hmm.
work in a heart clinic, and everybody that came in either had type 2 diabetes, obese, heart disease, different things like that. There was one guy that came in who was a former triathlon, and he had scarring on his heart, right?
Mm.
Your heart's a muscle, and as you know, and
Yeah.
if you overwork it, you can damage it and it can cause problems. And that's the trade off with professional athletes anyway. It's like you're putting your body at risk for the financial gain, and that's the trade off. But yeah, marathons even to me are professional feats. And it's just sometimes crazy to me that a lot of people just on a whim go out and do a marathon. It's like, man, I don't think you understand what kind of
Yeah.
wear and tear that puts on the body. And so yeah, doing 2 million steps in a month isn't something I would consider to be good for my body. It's good for my mind, I think.
Well,
Um,
there's trade-offs. There's, you accomplished something that was very, very difficult, and now that you accomplished that, it's probably easier to accomplish other things.
Absolutely. Right. Yeah. That perspective has definitely been shifted as far as what's hard and what's not, or what's a long walk and what's not. I did like 6, 7 hour walks on a regular basis. But yeah, my overall health score, though, because again, I'm walking all day. So my static health or my static resting heart rate um, definitely was elevated because I also wasn't able to sleep as well in the evening. And so just say, yeah, I was stressed for 30 days, you know.
And probably inflamed.
Yeah. Yes. The whole time.
You mentioned your Achilles tendon and it being
Hmm.
a concern. Well, sure, too much stress and inflammation, and you probably have to start every day when you start your walking again, probably a little slower and get the blood
Hmm.
flowing in them and get
Yep.
them stretchy again.
It's funny. I after like the first 5 days, I would have to do kind of like a 2 minute jog before I started walking because everything was so tight, and because walking compared to running, like you're just not getting as much rotation and flow. That if I warmed up a bit in the morning with a jog, the walk was better and easier, and so that was something that was unexpected for sure. But yeah, my Achilles was I couldn't jog for like 10 days. I could walk with no pain, but there it got to a point where any pressure to try and run, 10 out of 10 pain. Hmm. But I ended up
Yeah.
talking to a podiatrist right before I did this. There was a 10K we were all training for, me and my run club members. We've been training for this 10K since we started our club back in August, so we were all really excited about doing this 10K. But my Achilles was killing me. And the day before the race, I was at the expo. Bear Health had a booth at the expo, and I'm literally walking around the expo as my interns are manning the booth, and I see a podiatrist on stage talking about foot stuff for as you're gearing up for your race tomorrow. And so I figured I'd stop by and ask him a question about my Achilles. And so I told him everything I was doing. I was like, hey, I'm doing 2 million steps this month. I'm already 1.3 million steps in, and I really want to run tomorrow, but my Achilles is killing me. Should I even consider running tomorrow? Like, is it safe at all? I feel like if I go too hard, it'll tear. And he just casually was like, you'll probably be okay. Just make sure you're stretching, like mostly because everything is obviously just super tight, and get a heel insert. Put your heel insert in there, and you should be all right. So I walked to Walgreens immediately to get a heel insert. I put it in, and all of a sudden I could run with no pain.
Wow.
Yeah, it was unbelievable. And so I ended up running the race the next day.
Yeah. So you were having heel pain, I'm
Achilles,
guessing.
yeah, like
Achilles.
yeah.
Okay. Because, yeah, the Achilles comes down and kind of wraps underneath the heel there.
Hmm.
I was trying to understand how the heel support or whatever it was helped.
Yeah.
Um, I don't know.
I
I'm
think it
not a
just took pressure
podiatrist,
off.
but
Just took pressure off the, I guess, the flexing of the Achilles. Didn't flex as much because it was lifted up, and so kept it in a more stable position. I don't really know, but whatever was happening, it
I'm
was.
a fan of good support of the feet and arch supports and things like that.
Mhm.
They definitely make a difference. But when it came to the Achilles thing, I don't know. That's new for me. I don't. You're the first person I've known that has done 2 million steps in a month.
Yeah, no,
And
I think that that's a valuable insight. And if anybody is dealing with any Achilles pain, or just rehab, I would encourage them to consider that or talk to their provider about that.
as a healthcare professional, I probably would have went the other direction and said, no, you better sit this run out because the last thing I want is seeing someone rupture their Achilles, and what a horrible, painful injury,
Hmm.
debilitating.
Hmm. Yeah.
All right, well, tell us, Kwame, where do they go for more information? And tell me the name of the app again that they're going to search for if they haven't downloaded it yet.
Yeah, so if you want to find out your health score, download Dacadoo. So that's
Dr.
DACADOO. Use access code Dr.
Haley,
Haley.
DRHALEY, which is just like the drhaley.com blog. So that
Hmm.
works. That's a good one.
Perfect. And yeah, so once you're in, complete your health score assessment. Make sure you connect a tracker, so Fitbit, Garmin, Apple Health. If you're on Apple, you'll be instantly prompted to connected. If not, you'll have to go down to the track tab and connect trackers. But that way, all of your steps and stuff can track, and your health score can update in real time. And then, welcome to the Bear Health community. We have a mission over the next 30 day, or not the next 30 days. Our next campaign is for what we're calling the Bearathon, which will be a virtual run/walk event where we're going to try to cover enough ground as a community to reach the moon, right? So it's to celebrate the launch of Bear Health. We're going to try to cover as a community 239,000 miles in one day. And so to find us on Instagram, pretty much all social channels at Bear Health, that's BEHR Health. And my personal accounts are at Kwame Terra. So just how my name's spelled, KWAME TERRA. And yeah, follow the journey.
Perfect. Kwame, thanks so much for spending time with me today and sharing your experience.
Yeah, no, thanks for having me.
I hope you enjoyed that episode today on The Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.